Welcome back to Aesthetic Revolution, the podcast. I'm Dr. Ed Zimmerman, your host, and Staci Taylor Zimmerman, my model today, also Director of Aesthetics at Aesthetic Revolution, who will hopefully keep me from going down rabbit holes with too much trivia. And we're continuing our discussion from forehead to feet with some concentration in the middle, but starting at the top, where we were talking about facial evaluations. And we got as far as the forehead and the eyes a bit. And so we're going to work down a little bit further into our mid-face and the ratios of volume and proportions and things like that. So we talked a little bit about the golden rule, the golden number, 1.618, and the ratio of things. And it's pretty cool when you start to look at humans and actually many animals in nature and other things, is that 1.618, sit forward for me here. So if we measure Staci, and we can see that the width of her nose here, which is unaltered. I don't think you've stopped too many softballs or anything with that nose in your lifetime.
Never had it surgically altered.
Never surgically altered. So it measures about 31 millimeters. And if we take 1.618 and we multiply it by 3.1 centimeters, and that equals 1.618. 1.618. Got to get the decimal point right. Times 3.1 equals, 5. Just over 5. So let's see if her nose height is 1.618. And look at that. Perfection. Now the same thing happens.
What does that mean exactly?
So that your nose is the right width ratio for the right length ratio.
Okay.
And similarly, when we look about where do we place the greatest projection of the cheek, or is the cheek wide enough, if we use the eyeball as our width, so let's look up for me just a bit, face me so I can see you. My calipers are a little sticky today, they're brand new. So about 38 millimeters. So 1.618 times 3.8 is about a little over 6 centimeters. And then if we measure from the corner of her eye out to where the greatest projection of the cheek is, we can see that that measures, again, just about perfect. So the golden rule holds up again and again as we measure through facial proportions. And if we look through most ethnicities in both male and female, we'll see that there's a reasonable relationship between that and what we consider beautiful. If you do a conglomeration of what we feel is beautiful, women tend to have more of an elliptical shape up and down with an upwards V from the jawline. Men are more squared off. And of course, the problem with aging that we see is that as we lose volume in the upper face and the mid face and everything hangs down, women become more squared off and masculinized. And that's why we end up doing revolumization and face, upper neck, and lower face lifts to bring the tissue and the muscle coverings back up into shape and to re-volumize the fat pads and the soft volume that has involuted and deflated over time. So let's talk a little bit about noses. Noses are fun, but noses should be handled by people who have, in my opinion, been under the skin, or at least been present to see what's under the skin, because noses are fairly complex. A little bit about the anatomy. So the facial artery, just in front of this big masseter muscle here, when you grit your teeth, there's a muscle, and just in front of it, at the edge of the bone there, you can feel a pulse. And that's your facial artery. And it comes up along the angular artery and branches up along the sides of the nose in general. But there can be lots of variations. So one of the things we do in order to make this a more safe procedure, because why do we care? Well, because some of these arteries come up, and the ones above the eyes, on the nose, and around the branch that comes up along the front of the ear and then goes up into the temple, some of them go to the back of the eye. And depending on which source you read, which peer-reviewed literature you read, the risk of having an embolic phenomenon by accidentally injecting a blood vessel, in this case an arterial supply that actually connects to the back of the eye, and then causing blindness, is somewhere between 1 in 6,000 and 1 in 10,000. So it doesn't happen very often, but when it does happen, it's catastrophic. Other things that can happen with vascular or embolic occlusions are that you can have a slough of tissue, or you can have a prolonged bruise, or you can have a paresthesia where the nerve gets knocked down and either feels pain or tingly or itchy or funny or whatever. So we want to avoid those things as much as possible, because we're basically injecting blindly into the face when we're injecting fillers. Let's face it. It's not like just smushing down on a nose and then elongating the clay and moving things around. We're actually putting something underneath, unless we have a window to the tissue. And so if we use a handheld ultrasound like we use, we can either do ultrasound-guided injections, which are very challenging to hold the ultrasound and the injection and tripod on the face and not move and inject only on the retrograde and all those things all at once. Or we can at least do an ultrasound examination of places that have a lot of blood vessels and get a feel for the lay of the land. Are the blood vessels superficial? Are they deep? So when we use a handheld ultrasound with a color flow Doppler, it allows us to see the arterial flow. We don't necessarily know till we flip 90 degrees of our flows going up or down, away from or towards the Doppler, but we can at least see which of the, in general, 5 layers of the skin, of the tissue, the blood vessels are. Typically, depending on where you are in the nose, most of them are a little off-center, unless the nose has been surgerized. Most of them are reasonably in the middle layers. So if you bring the bevel of your needle, if you're using a needle, which is my preference, I feel that it's a little more controlled than a cannula in this area, and a small cannula looks just like a needle to the tissues. But if you bring the bevel edge flipped down so that the filler is projected down onto the bone, if you're actually putting the very, very tip on bone ever so gently, you're as close to the periosteum as you can be, and you are less likely with a very small aliquot and on a retrograde injection to be in a vessel and occlude that vessel. Obviously, you're looking very closely for any blanching, any bruising, bleeding, anything like that going on. There are a lot of ways to skin this cat, pardon the analogy, because some people will go from the tip of the nose and lay a needle or cannula up straight, or a thread, and we can talk about PDO and PDCL, absorbable threads over time. But, you know, I certainly have the most experience and think it's the most artistic to be able to put tiny, tiny Hershey kisses of filler strategically in different parts of the nose, but mainly the midline. If you're going to go off midline, you got to be really careful, really slow, and inject on the retrograde. Never inject as the needle's moving forward, because if you go into a vessel,
so let's not talk so much about your techniques of doing that, but
down the rabbit hole.
Yeah, down the rabbit hole.
But
back up.
Either way, what we're trying to do is generally to hide a hump in a nose or a bridge that's too sunken. There's no place to put your sunglasses, either because of ethnic heritage or trauma, or that's just the way God made you, or to lift a tip, recognizing that sometimes the tip dives because the muscles around the upper lip and that lift the upper lip cause this lip to shorten and the tip of the nose to dive down when you smile. So it may not be a filler issue, it may be a neuromodulator issue, or a combination of those things. Another thing we notice is when people have flared nostrils, when they get very excited about things. And the two nostrils are sisters or brothers, not identical twins. So we can use our fillers to very carefully, with very, very, very small needles, even out the openings of the ala and the width of the ala, even if you've had surgery, and to take a floppy columella, the strut that goes from filtral apex all the way out to the tip and actually stiffen that up and lift the tip out. So we can do lots of things with the width and the shapes of the noses. And if the flares are there because of muscles, we can use a little bit of neuromodulator to settle that down. So lots of things we can do with noses.
You do amazing noses.
We do pretty nice noses.
You do.
It's something we have passion for because the nose is seen in proportion to the forehead and the cheeks and the mouth. So someone who comes in and says, well, I feel like my nose has gotten too big, and go, well, let's look at all of you and let's look at a picture from a number of years ago when you came off the assembly line and see if that's the way God created you, or if that's something that's happened over time and we want to put the cheeks more back in proportion, because when you get your cheeks back, the nose looks smaller. When you get your lips back, the nose may look more in proportion to the up and down thirds of the face. So yeah, that's critical to recognize that and to do that analysis before you open your first syringe of anything.
Right.
And before we talk about what syringes of whatever we're going to use too, because there are choices to be made there.
Right.
Then there's cheeks. Cheeks are, if the face is seen much like a suspension bridge, and we start at the lateral brows and the temples lift the lateral cheeks and create the Nike swoop that goes from the inner canthus all the way out along the cheek and then all the way back to above the top of the ear. This whole area here, it's critical that this be the widest part of the face, particularly in women, because it brings all the attention to their eyes. It gives them that upwards V that's very exciting and very exotic. And then, of course, we've talked a little bit about the eyes and how we have to have the right blend of anterior platform showing, less fat here over the medial canthus so that goes in a little bit. That sexy hollow in the inner part of the eye without looking too hollow. So that it looks healthy is very important to the mystique and the drama that you create around the eye and frame the eye. And then, of course, where we lose lots of volume here along the lateral canthus, that lets the lateral canthus go down, we can very carefully reinflate that with the right kinds of fillers without having to put implants in anymore. So we are able to do these things non-surgically, which is very it's a lot of fun.
One of the things that we didn't touch on was the temples, because that's another one that we do a lot of, and you call them peanut heads.
So I call them peanut heads. When people come in and their eye isn't framed and they go, I don't know, I don't see it. And they go, let's look at a picture of you from mid-20s or 20 years ago, whatever is more appropriate, and see whether you had those super hollow temples. Especially in early days of fillers, we certainly saw lots of people paying attention to cheeks. And so they would put a needle in at the bottom of the smile line or the nasolabial fold, and they'd fan around because they didn't want to get too close to the eyes. And they turned these Jersey-licious people out, and it was even more noticeable because they had hollow temples. That makes the hollow temples even more apparent. So filling in the temples lifts the lateral canthus, lifts that whole cheek up, actually adds elevation to the corner of the mouth, gives the zygomaticus major and minor a place to lift the smile and balance the upwards elevation and the downwards pull of the DAOs and DLIs and such, so that the corners of the mouth come up. And you have someone who looks happy in life when they are happy and doesn't look grumpy even when they are happy. So yeah, temples are important, and temples are a challenging area to inject, and that's a whole nother podcast or class or something like that. But suffice it to say, it's important to fill temples. There's not a good surgical intervention there necessarily, although we have put grafted fat into temples for decades with pretty good retention. But fillers certainly work great back there. Of course, you want to use a filler with enough lift to really get enough bang for your buck, and not to make people look bulbous, because that's the other thing, is if you do too much, then you have this odd look around the eye. They look kind of like coneheads and brainiacs mixed together.
As we're talking, I'm kind of thinking from the perspective of somebody that realizes that, they want to do something, but they're not really sure what it is, or their girlfriend had their lips done and they just look so much better, or they had something done, but they're not sure what it is. I just want to say it's really, really important to go in and see someone like you that knows how to evaluate the whole face, because just going to have your lips done because you think it's going to make your whole face look better is wrong. And if an injector, all they really do is lips, to go to them and expect them to be able to evaluate your whole entire face and tell you how to get the result that you want is probably not, you're probably not going to be happy with that. And so I just want to reiterate that or make that known that it is really important to go to the right injector to be able to point out, where strategically, like you said, you need it, and not just fill your lips because you think that's going to make you feel better, or just your cheekbones when really there's other places that you need the temples, you need other things. So
sure. If you only have one hammer, all the nails look alike.
Right.
And when it comes to an injector that's comfortable injecting one place but doesn't really review, discuss, evaluate, and negotiate the other areas.
Right.
Because very often when we're doing a liquid facelift or a liquid rejuvenation, we need to look at all these areas and explain why it's important, and then negotiate which ones we have the budget or the ability to, because some areas, easy peasy, rarely bruise, rarely show any significant swelling. Other areas, higher risk of bruising and swelling, so you don't do right before a social engagement.
Mm-hmm.
But yeah, if your injector treats primarily one area, and that happens to be the area that needs to be enhanced, because even a blind squirrel finds a nut once in a while, you may get lucky.
Mm-hmm.
But over time, probably more better to go to someone who looks at the whole picture, the 30,000-foot view, and then can strategically come down on each of those areas individually, lay out a plan of how to get there and stay there, maintenance, over months, years, decades. So you turn back the clock and you kind of hold it there rather than, or gracefully age, so that you just look super appropriate for your chronologic age.
Yeah.
So
that's what most of our patients, that's what we hear most.
That's why people come to us, is because we don't turn them into Pillsbury Dough people. And we try very hard to continue to educate. Obviously, it's a discussion, and somebody comes in and goes, well, I really need my cheeks. Okay, let's do your cheeks today, but let's look at the pictures and you tell me what the difference is between this younger picture of you and this picture. Did you like your younger one better? Yes, I did. What was different? If you can see the difference, you're more likely to buy into it and allow us to help you there. And it may not, it may take multiple visits before you finally go, oh, you know what? I did have less hollow temples there, and it did lift my cheek without overinflating my cheek. And. So, it takes a village, and it takes time.
I think a good example is my niece, when she wanted her nose, a little hump that she had in her nose, and you filled that, but then you gave her a little projection in her chin, which she never thought about it, never even bothered her or whatever. But the difference in the before and after of this profile of her face was amazing. Amazing. Yes, to me. And she loved it too.
Well,
she
absolutely, it took some getting used to.
Because
she'd never had a chin before.
Yeah, and so, but it looked amazing, and I think it's just something that she didn't think that was. She was young. She's young. She's in her early 20s, so it didn't dawn on her. She just had this issue with her nose that she didn't like, and probably was thinking, "Oh, I'd like to do my lips like a lot of girls her age." But really, just adding some chin to her made her proportions just look so much better. So,
well, in general, people do better in life. They do better in life at work. They do better in life in love and everything else if they're taller, and if they have a robust jawline and a good chin. I can't make you taller, but I can give you a great sculpted jawline and a lovely chin that's appropriate to the proportions of your face. We can narrow it down. We can square it up. We can make it a little longer or higher. We can give it a little more projection. If it's got a huge amount of projection, I can't pull it back. But maybe in proportion to the lack of projection in the cheeks or the lack of volume in the angles, we can decrease the apparent visibility of that chin in someone who has a super strong chin line. So lots of things that we can do. And we can do it with fillers that don't necessarily last as long, but let you at least dip your toe in the ocean and go, do I really like this shape? If I don't like it, I can make it go away with an enzyme. Or if I really like it, I can put in a long-lasting filler like what I've had in my cheeks for the past 8 years, so I don't have to keep coming back for the same thing over and over again. I can get off the hamster wheel and do other things aesthetically. So kind of cool. So we've done the nose. Let's talk a little bit about the cheeks. We've talked about the Nike Swoop and how important it is to have cheeks. Some people, underneath the mound of the cheek, they're flat. Some people go out a little bit, and some people have a little indent. And that indent, that chiseled look, some people pay thousands of dollars to get, because to get it, if they don't have it, we need to elevate and widen the cheek a little bit, increase our swoop. And we also need to address the jawline and make that a little bit wider. We don't generally make the mandible wider in women. We usually give it a little more height, where the angle's being absorbed. Mother Nature's stealing the calcium out of that angle. But in order to get that sexy hollow, which is actually where there's a little bit of a ligament, when we do a facelift and we lift the skin off of the smaz, the covering of the muscles, there's a condensation here that has to be released. And fillers can't always do that very easily. But sometimes we can get pretty creative. And for people who don't want to have that sexy hollow, we can make it less apparent. For people who do want to have the sexy hollow, who spend lots of time and money every morning rouging that in to make it look like there's more shadow there, we can make it very apparent by creating and revising, volumizing the projection of the cheek, the projection of the zygoma, and a little bit of the projection along the jawline, so that sexy hollow becomes even more defined. It's important to do the area in front of the ear a little bit so that the face doesn't go back and dive in like there was a shelf there. So it has to be an even blend and transition. And then, some people have more projection in their cheeks and more width. That makes them look a little more jovial. Some people want a little more chiseled. And so we need to respect those things as well. What we don't want to see is so much projection and so much volume in the cheeks that when they smile, it looks like they're looking out over the bill of a ball cap. So when your cheek is so big that you see it when you smile, if it wasn't the way you were born, you've probably got a little too much filler in there. Let it come down.
Well, and I've noticed too is that women that get a lot of filler there, also at the same time as we're aging, these lids are getting heavier too. So you've got the problem of your lids are kind of drooping, and now you've put filler in, so
the eye looks smaller.
It looks much smaller.
Yeah, so when you smile, the eye crunches down and it doesn't look welcoming, whereas we use neuromodulators to relax the muscle of the orbicularis oculi around the eye, and then that relaxes when you smile, the eye actually enlarges and looks more welcoming. So a little trick we use in Las Vegas, probably in Hollywood too. So in the cheek, because it moves so much, we have to be very careful about what fillers we use where. And so certain fillers that have microspheres, we don't use where there's a lot of compensatory pull up along the edge of the orbits and things like that. So recognizing what we can use where, irregardless of how long it lasts. But we know as injectors that even the fillers that the companies say last 6 months, a year, 2 years, in different tissue planes, they can last for years. And it's not unusual for people to come in and they have this bluish, moundy material underneath their eyes. And they go, well, I haven't had fillers in 2 years. And, it's reality is that filler was deep under the muscle. It was protected from being resorbed in the circulation. And it's been squeezed out and up into the soft tissue under the eyes where the light refracts off of it and looks bluish because it's actually hitting the water molecules in the hyaluronic gels. And so that has to be dissolved and go away. And that's a matter of placing the filler in the right levels, the 5 levels from the skin down to the bone, so that the muscles can't push it through the tissue as much, or integrating it in a way that it's blended so we don't get those things. Because fillers can move around in some cases, depending on what was put in, where it was put in, how it was put in. So we've talked a little bit about the forehead, around the eyes, the cheeks, the nose, the chin width, chin height, things like that. But we've not really talked about the lips so far. And the lips are a critical part of the evaluation of the face, because when people meet you, they look in your eyes, they scan down to your chin. They probably lag a little bit around the lips to make sure that you have enough lippage to be appropriate for your age and your sexual orientation. So let's talk a little bit about lips. Everybody has them. Amazing. Lips are also in proportion, and that magic number 1 to 1.618 is often quoted as the ratio between the upper lip is 1 and the lower lip is 1.618. But the variations are rampant. Many times they're 1 to 1. Sometimes the upper lip has more height to it than the lower lip. But certainly one of the critical things with aging is that as we lose volume, as the skeleton no longer supports pulling the lips wide on the face, and the lips start to turn in and lose volume because the dentition isn't pushing them out, we start to lose the corners of our lips. And in a youthful face, the width of the lip goes from a perpendicular in the mid-pupillary line drop down on each side, and you have the full width of the lip showing. And as we get older, what we see is this gets thinner and thinner, and we end up Betty booping, and only the center portion of the lips show. So that's one thing that's going on. The volume that's lost from the edge of the vermilion margin, that pink part, into the white lip up between the lip and the nose, as that reduces, the orbicularis oris muscle, the muscle that goes around like a donut around the lips that lets you make kissy lips, that muscle mass is preserved more than this subcutaneous soft tissue mass. And so the lips start to either pooch out or pull in, like somebody who doesn't have good denture to support their lips. And so when we look,
I seem to notice that more often.
Yeah. And so interestingly enough, some people want their lips bigger. And so we have that discussion. What part of the lips are we going to make bigger? Are we going to have more elevation of the 3 cushions in the upper lip, or of the 2 cushions in the lower lip? And a lot of time we see, particularly in our Gen Zers and younger gals, are coming in with what I call tubular lips or hot dog lips. They've lost all their cushions. They've lost the artistic presentation of the lip. And some people, of course, are doing the dental floss between the teeth. They're pulling down and they're really hyper accentuating the cushions and making the lips much bigger than they ought to be for that particular face. That's another trend that's come in and out. But for timeless lips, which is what we like to concentrate on, we have a nice proportion between the upper lip and the lower lip that, when the lips are gently apart, shows off the cushions above and below, that has a full width from mid-pupillary line to mid-pupillary line, that has proportions where you're about a third here and roughly 2/3 down here in terms of width, that has enough volume in the corners that you don't have a lot of commissure fold here, although sometimes you've got to address all the way back to in front of the ear to get enough volume to pull that back and have enough chin to pull this tissue. And sometimes it just needs volume. If people have lost dentition, then we need to work with their dentist to give them a little better support so that the lips are out. And then when we watch people, as we're talking with them, we're watching to see, do they have a hypermobile chin? Is that chin moving up and down and getting walnutty and crinkly around them? That's a neuromodulator thing. Or what's going on with the lips? When they smile, does the upper lip come up so much that they have a gummy smile? Do we need to relax the muscle that goes between the side of the nose and elevates the lip? Or do they purse too much? Or do we need to relax that pursing with what we call a lip lift, just a lip flip, with just a little bit of relaxing of that muscle? A lip lift is more of a surgical thing, where when this dimension has gotten too long, the philtral pillars have gotten flattened too long, and they get a duckbill deformity, we actually go in surgically. I like to use the CO2 laser for this, and under local anesthetic, very carefully take out a piece of the skin here centrally from the alar folds on either side, hiding just inside the nose, and let this roll up, take a little bit out. So that's kind of another thing that we can do. I'm not a fan of the old triangles that used to be taken out at the corner to lift the corners of the lips that we did 20, 30 years ago, because now we can do that with fillers. We really don't need to have a scar along the edge of the vermilion margin any there, because it usually hypopigments and it's just a little too present. So I'm not a fan of that. But lots of things that we can do with fillers and toxins amalgamating together to really rejuvenate the lips and make it seem like part of the face. The lips as a standalone, I rarely do. They're usually connected to the tissue around them in order to make them seem like they're part of the face and they belong on that face. So what else do we need to talk about?
The jawline. Let's talk specifically about the jawline and how we...
So the jawline is another fun area because it's where the upper neck and the lower face meet. So there's a balance between the lift up and the pull down. And the platysma muscle that runs around the neck is kind of a remnant of a muscle that we see strong in giraffes and horses and people, not people, animals that walk around on 4 legs. But since we've had the audacity to stand on 2 legs, this muscle isn't needed to stick our head out in front of us very much. We use the sternocleidomastoid to turn our head, and we use our traps to keep our head up. But this muscle here we see primarily when we make funny faces. So when we pull down or grimace and go like this, these muscles that pull down, they're pulling down and de-accentuating the sharpness of the jawline. So one of the things that we do to strengthen that up is to put little aliquots of neuromodulators along here and into the tops of these bands. Mine are on the side, but some people have them in front, and we relax those muscles. We surgically can remove, trim, lice, roll in and sew tight. There's lots of ways to treat those muscles surgically, but Mother Nature almost always makes them recur. And so putting a little bit of neuromodulator in to relax the pull down and allow us to have more pull up to chisel that jawline helps. But some people have lost volume. And so we need to replace the volume of the prejowl sulcus, where they've become hollow here, which makes the chin look pointy. We need to replace a little bit of chin height. And so that volume is going underneath, not just projection. So we're not Jay Lenoing people. I like Jay in his cars, but we don't want everybody to present that in that particular manner. And then what's very, very common along the jawline is we get back to this point called the angles. And there used to be angle implants, but they're rarely done anymore because we can take this and chisel it off. And so what we see is the angle that the front of the jawline goes back should be carried to the back of the jawline, and you can drop a perpendicular here and that gets filled in. But what we see in a lot of people, particularly women, is this calcium gets grabbed by Mother Nature, and so their jawline goes back and then it goes straight up to their earlobe. And that's a dead giveaway of aging, especially if you do a facelift and pull up tight over that. It really accentuates that lack of volume. So what we can do with our microsphere fillers or our long-lasting microsphere fillers is recreate that and fill that back in. That lifts the neck and really carves out the angle of the jaw there, accentuates it, sculpts it, but the volume in women is going underneath, the volume in guys is going laterally. So in guys, we're squaring them off. In women, we're lengthening and give them more of an ellipse there to give them that beautiful upwards V. And we're making sure the chin and the prejowl sulcus fit with that. That de-emphasizes the buccal bulge or buccal fat without having to pull the buccal fat out. One less surgery that we rarely do. So that's kind of the neck and the chiseling of the neck and the strengthening of the jawline so that people do better in life. I think the rest of the neck is really a topic for another podcast because there's lots of things involved. We have the submandibular glands as well as the platysmal bands and the width of the neck and the eradication of the subcutaneous tissue and the necklace lines. Yeah, that's going to be another podcast.
And we can
think about it.
We can do that with a lower face and neck lift and talk more about it.
Yep.
We can do that.
And that's going to lead us down to the décolleté and everything that has to go with that. So we'll work our way down in our tour of rejuvenating the body. But we're having a great time. So we started here at the head and we'll work our way down. And thanks for listening to another episode of Aesthetic Revolution, the podcast. Like, look, listen, subscribe, ask questions. We love answering your questions because they're things that other people were wanting to ask and just too shy to ask. So get back to us on that stuff. And Staci and I will be back for another episode soon. Thanks for listening.